You're watching Wisconsin Eye, an independent, nonprofit public affairs network, engaging the citizens of Wisconsin since 2007 through access to government proceedings and public policy events.
Westergaard, Chief Medical Officer in the Bureau of Communicable Diseases, and we will begin, as we do, with remarks from Deputy Secretary Julie Willems Van Dijk.
Well, good afternoon, and thank you for joining us today. As of today, we have reached 612,233 total confirmed cases of COVID-19 in Wisconsin. Our 7-day average of new cases is 69. We have lost 7,253 Wisconsinites to this virus, and our thoughts go out to their families and friends as we redouble our efforts to stop the spread and vaccinate more residents of our state. We have administered well over 5.4 million doses of COVID-19 vaccine in Wisconsin, and almost 50% of Wisconsin residents have received at least one dose, and 45.4% of Wisconsinites have completed their vaccine series. Wisconsin's numbers are consistent with national rates, where the CDC reports 45.2% of the nation's residents have completed their vaccine series. Over 80% of Wisconsin residents age 65 and older have completed their vaccine series. Of course, this population has been eligible for vaccine longer than others, and that was because we looked at the data and saw how serious COVID-19 was for older Wisconsinites. We are thankful they stepped up to get vaccinated, and thankful to our vaccine providers, our long-term care facilities, and all the partners who worked with us to make those numbers possible. There is, however, much more work to be done, and we look forward to seeing younger age groups catch up to their parents and grandparents in terms of vaccination rates. This is even more important with the rapid spread of the Delta variant. As Dr. Westergaard said at our last briefing, every COVID-19 death is a preventable death. Vaccination is our most important tool to prevent more Wisconsinites from dying from this disease. Getting vaccinated is incredibly important, especially when it comes to protecting the children of our state. Remember, kids age 12 and up are eligible for the COVID-19 vaccine made by Pfizer. It is safe for them, and it is effective. If you have any questions about it as a parent, I encourage you to reach out to your child's pediatrician to get answers and learn more about why they recommend this vaccine. And until younger children can receive the vaccine, Higher vaccination rates are very important to protect them. We also want to take additional steps to protect our kids who are too young to access the vaccine. And that is why testing in schools is so important, and why DHS has been working closely with DPI to develop a comprehensive, voluntary, and free of charge testing program for K-12 schools in our state. Because testing can identify COVID-19 cases early, it provides the information our schools and parents need to keep their students and children safe and to prevent spread in our communities. The program is designed to minimize the workload on schools so that Wisconsin educators can focus on what they do best, which is educating our kids, our state's children. And state government can do what we do best, along with our lab partners, which is focus on logistics and meeting the testing needs of our schools as those needs evolve. The opt-in program will support schools to determine the best fit when it comes to testing options. They can select from diagnostic testing of symptomatic and close contacts, event-based testing, routine screening testing, or outbreak testing, or any combination of the above. And thanks to our robust partnerships with labs across our state and the lessons we have learned throughout the pandemic, this K-12 program is built on effective guidance and stands to make a real difference going into and throughout the next school year. This briefing is exactly 14 months to the day since I first briefed you with Major General Knapp from the State Emergency Operations Center. At that time, we were a little over 60 days into the SEOC's activation. And during that briefing, I talked about collaboration across state government, across healthcare systems, testing labs, and I thanked our local and tribal health departments and the Wisconsin National Guard for their incredible partnership and dedication to the health and safety of Wisconsin residents. And I thanked you, the residents of our state, for doing your part to stop the spread, to flatten the curve, and to move Wisconsin through the pandemic. Like I said that day at the SEOC, we are doing this work for you, and we are doing this work with you. And that is still true today. We're still doing this work with you, and we are getting more and more people vaccinated, and we are moving through this pandemic together. So thank you for doing your part, for getting vaccinated, for encouraging your friends and family to do the same, and for taking care of each other and building resilience throughout this pandemic. So with that, I'll turn it back to you, Elizabeth, and we welcome your questions.
Thank you. And a reminder to maintain audio quality, please remain muted until it's time to ask your question. If you're able to do so, use *6 to mute and unmute your phone. And in the interest of time, to ensure everyone is able to ask a question, we ask you to limit yourself to just one question. And we begin with Denise Lockwood at the Racine County Eye. Denise? Denise Lockwood, Racine County Eye. All right, we'll try to get back to her, and let's go to Rob Sussman, WTAQ in Green Bay. Rob Sussman.
Yeah, thanks for taking my question. It was announced today that the White House does not believe that the United States is going to meet its July 4th goal for 70% vaccination. What's kind of your immediate reaction to that, and just kind of your reaction to how slow things kind of have been going over the past couple of weeks here in Wisconsin? Thank you.
Well, I think they also announced that 16 states and the District of Columbia have met that goal of 70% vaccination of people over 18 in their states. So what that says to me is it is possible. And each and every state can achieve that goal. And we're not done. That's what it says to me. I want to be really clear that the president set that as a benchmark, as a stretch goal for our vaccination efforts. It was never meant to be interpreted as the final goal or, a new definition of herd immunity. It was a stop along the way. And so those of us who will not get to 70% by the 4th of July need to keep up all of our efforts to continue to reach 70%, hopefully 75%, 80% as we continue to move through the summer and fall months. So as we've said, we knew there would come a time that we would, quickly vaccinate those who were eager to get the vaccine. And then it would be a slower process to continue to provide the kind of information and education that residents of Wisconsin need in order to make an informed decision. And we continue to do that. In fact, as we announced at our last media briefing, our Stop the Spread campaign is actively out in the field. And my colleagues who are monitoring that campaign tell me that our messages that are educational, that are telling people more about the COVID-19 vaccines are the ones that are getting the greatest uptake. So what that says to me is there are still people who are learning. There are still people considering this vaccine. There are thousands of people still getting their first vaccine every day in Wisconsin. It's closer to 4, 5, 6,000 instead of 40, 50, 60,000 first day doses as we were seeing a few months ago. But we will continue to protect people every 3, 4, 5,000 at a time, and we will keep on with those efforts.
Thank you for that. Let's give the next question to Todd Richmond at the Associated Press. Todd Richmond.
Hi there. Julie, I'm wondering if you might be able to walk me through how this school testing program is going to work on the ground, and if I'm a school district, do I get free tests and then I give them to the state after I take the samples, and then the state sends them to a lab? How exactly will this work on the ground in detail?
Great. Thanks for that question, Todd. Before I answer that, I just want to say the reason this is so important is just to remember that, as I said in my opening comments, our children under age 12 are not yet eligible for vaccine. And our vaccine rates for children 12 to 17 are still only in around 25-30% and much lower in some parts of the state. So this whole program is very important for us to be testing and detecting disease early in a population that is quite susceptible and that is in an environment that is susceptible to spreading disease with lots of people together inside, especially once the winter months start to hit and we can't be outside and have fresh air ventilation. So it's a really important strategy for us to be protecting children in our schools and making sure that we know we can also differentiate as people start to get more respiratory viruses, who just has the common cold and who has COVID-19 and perhaps who has influenza. And so we can take appropriate precautions for each of those children and the children they've been in close contact with. So how it's going to work is we're announcing it right now here on June 22nd so that we can get ready for that first day of school in late August, early September. So as I mentioned, schools will have we're encouraging them to use the guidance from CDC around what model of testing to use. That CDC guidance right now says the one thing that every school should be doing is what we call diagnostic testing, is making it easy if children show up with a cough, with a fever, with respiratory congestion, that they can go somewhere at their school and get a nasal swab that will be tested to determine whether they have COVID-19 or not. So that's one element. Another element, and especially for communities that may have higher rates of COVID-19 in their community, is to do some type of periodic screening of a larger group of students and staff. And CDC recommends that that is very much tied to the prevalence of COVID-19 in your community. And a third element is for those schools may want to do some more intensive testing or screening with certain groups, like extra students participating in extracurricular activities or before big events like a homecoming or prom dance. So we'll provide tests that they could use for those type of situations. What will happen is we're surveying the announcement today. What went out to every school district in the state is a survey. We'll be asking schools what the level of testing that they are interested in would be. We have contracts with numerous vendors, testing vendors across our state. We have asked them not only to add the ability to analyze the tests in their labs, but to also add teams that can go to schools and do specimen collection in the schools. And so this survey will really be looking at each school district and asking them a series of questions about what they need in terms of, which components of the testing program they'd like to elect, what they need in terms of people to collect the specimens. Now, some school districts have adequate staff that they've hired. They have school nurses or they have school health aides that they've already trained in this, and that's fine. We welcome schools using their own staff, but for those that don't, we want to pair them with one of our vendors who can enhance their staff capacity to collect specimens, and so the state's role will be matchmaking between the needs of the school and the needs of our different testing vendors. They will all be using the system we've used at our community testing sites. And so it's an electronic system where students will get enrolled in that system with their parents' contact information. The tests will be executed and the results will come back to the student and their parents directly through that electronic mechanism. So that will protect confidentiality in the testing. Any positive test will then, of course, be reported to the local public health agency as any positive COVID test is, and appropriate action will be taken, as has been throughout the pandemic, by the local health officer. So I hope that helps give a little bit more visibility into how the system will work. But it's really been designed around a number of districts that we have supported with testing in the spring months. The lessons we've learned, what we've heard from schools is they want a say in how they do testing in their district. And we're trying very hard to produce a system that has a lot of flexibility in it, that can best meet the needs of each district, whether you're the winter school district up in Sawyer County in a rural place very far away from the labs, or if you're a school in Madison, Wisconsin, right down the road from Exact Sciences.
Thank you for that. Let's go now to David Wahlberg at the Wisconsin State Journal. David Wahlberg.
Yeah, thank you. It looks like reports of cases involving the Delta variant still have been relatively rare in Wisconsin. Does that seem to be changing at all? And what are the implications if we do start seeing more of this variant here?
Dr. Westergaard, would you like to respond to that?
Sure. Our colleagues at the State Lab of Hygiene and our partners at a number of other high complexity labs have been continually doing the whole genome sequencing on residual specimens that come from positive COVID-19 tests. So we have our awareness of what variants are circulating come from that somewhat more complicated process. That one of the caveats, though, is there's a lag to generating that genetic data that we need to understand that. So So that's the first point is up until this moment, the sequences that we are detecting are usually from between 2 and 4 weeks ago. So, we haven't seen large numbers. I think it's still less than 40 in terms of the cases of the Delta variant. But we've learned a lot, and we're watching the data from the global pandemic very closely. And what we've seen with the Delta variant is that it tends to eventually outcompete or become the dominant strain everywhere that it has had some time to circulate. It was first seen in India, where they had a very severe epidemic over the spring and summer, and then in the United Kingdom and other places in Europe. So we've experienced this before with the Alpha variant, when the initial variant of concern that we had that we observed spread more quickly. It was about 3 or 4 months after it started peaking in Europe that we started seeing it become the predominant variant in the United States. So it's possible, perhaps likely, that we'll see that same pattern. Given time, this variant, the Delta variant, which has a track record of spreading more quickly and sort of pushing out the other variants, could result in seeing that become the predominant strain in all areas of the country. So what are the implications of that? Well, the implications are that it's the risk of becoming infected, given that you're exposed to an infected person, is higher. And for unvaccinated people, that means the risk of becoming, getting severe COVID vaccine is higher than it was with the Alpha variant and with the original strain. So the stakes are higher in a sense. And it's one of the reasons that right now in the summer, we want to encourage everyone to get vaccinated. Now is really the time where we build up our protection so that in the coming weeks and the coming months, or if we see a seasonal surge in COVID-19 activity like we did last year, we have high levels of protection in the community. Because one of the things with more transmissible or more contagious variants is we need a higher percentage of people to be vaccinated to prevent outbreaks and to prevent small cases from growing into the community. So we don't have evidence for sure that it's a more dangerous or virulent, meaning it causes more severe disease. But if more people get infected and it spreads more quickly, that's going to translate to more people sick, more people in the hospital, and more people dying. So we really want to get ahead of this. We want to get high levels of vaccination before we see this more transmissible variant really take over and become the predominant strain in our region.
Thank you for that. Let's give the next question to Eric Gunn at the Wisconsin Examiner. Eric Gunn.
Hi, thank you for taking the question. I'm wondering, are you seeing any correlation, maybe technically I should say inverse correlation, in counties or even smaller geographic units between case rates, hospitalization rates, or death rates on the one hand, and vaccination rates in those areas on the other? And if you're not seeing that yet, are you watching for it? Thank you.
Dr. Westergaard, do you know if we've done any such analysis?
We have sort of ongoing surveillance and awareness of all our hospital systems, and have not done an analysis with sort of advanced statistical methods to show such a correlation. But we are collecting the data that would allow us to track that. So don't have data on hand that specifically answers your question, but yes, we are able to track that, and we are tracking it.
I think the other thing I'd add to that, Eric, is that, in our state, we'd be dealing with very small numbers at this point in time. And so, tracking it over a period of time will help alleviate that. And this is also the type of analysis that will be done at the national and the international level as we move forward.
Thank you for that. Let's go now to Sean Kirkby, Wisconsin Health News. Sean Kirkby.
Hi, thank you for holding this. I was just wondering, for the DHS community-based vaccination clinics that are run with AMI, they're winding down their operations. Is the state looking at continuing to work with AMI or perhaps doing, mobile clinics? Or is that work going to be mostly just transitioned to local health departments, healthcare providers? Thanks.
Thanks for that question, Sean. Yes, we are working with AMI. They are transforming their system from a mass vaccination system to a mobile vaccination team system to help enhance efforts around the communities where they have been located, which is where their staff are located. And they are a great enhancement to the mobile vaccination teams that we currently have through the National Guard. So we are doing exactly what you asked, and we also have been working closely with the local health departments in each of those communities from the very beginning. When the AMI sites were located, they were sited there at the invitation of local health departments in those communities. And so as we continue to evolve the services, we are doing it in close collaboration with the local health departments.
Thank you. Let's go now to Christina Van Zels, WITI in Milwaukee. Christina, WITI Milwaukee.
Hi there. Thank you for holding this. My question is, what, if any, are your concerns ahead of the 4th of July, just with the vaccination rates, as we've already mentioned, being slowed down a little bit? What concerns might you have just ahead of the holiday?
Well, I think our recommendations are pretty clear from CDC, which is if you're vaccinated, you are okay to be out and about without a mask and interacting with folks. If you are not vaccinated, you are clearly at risk, continuing risk for disease, and that risk continues to be present and perhaps increasing with the presence of, as we just discussed, the Delta variant in our state, which we know is more virulent. So we would recommend that people who are not yet vaccinated, if they are out and about, that they wear a mask, particularly if they are indoors with people outside of their family who are also unvaccinated. That is really critical to stopping the spread of the disease for those members of our state who are not yet vaccinated. And I know many people have heard the message about removing masks for those who are vaccinated and sometimes fail to hear the part that says for those who are vaccinated. The safest method for preventing spread of disease for those who are not vaccinated right now continues to be wearing a mask to protect themselves from other people who could be spreading COVID-19 and protecting others from them spreading the disease. Dr. Westergaard, what else would you add?
Well, I'm concerned about one additional thing that we're starting to see with the help of our respiratory disease epidemiologists. They're letting us know that we're seeing increases in the number of non-COVID respiratory viruses. So viruses that cause the common cold and the seasonal coronavirus. So as we recall, when we start learning about COVID-19, it's caused by a coronavirus, which is a large family of respiratory viruses. So recently we're starting to see spikes, increases in cases due to those non-COVID coronaviruses. And that's, that tells us that, the human behavior, which is normal human behavior of people interacting and being exposed to respiratory droplets is on the increase. And so there's both that should be a warning sign or a reminder that we have learned a lot about how to prevent respiratory viruses in general. And some of these respiratory viruses can be serious, particularly if they get to people who are in institutions and nursing homes. We've had outbreaks in assisted living and nursing home facilities with seasonal coronavirus that have resulted in hospitalization. So I think it's good for people to remember that there are a lot of reasons to wash hands and be mindful of physical distance. And I also agree very much with Julie, although I know a lot of people are probably tired of hearing this, is that our best recommendation is for people who are not yet vaccinated to wear masks when they gather indoors with other people. The concern with both the spread of additional respiratory viruses and new, more transmissible variants such as the Delta variant really makes it continually important that we do that. So we still do recommend people wear masks until they get vaccinated.
Thank you both for that. We go now to Brittany Schmidt, WBAY in Green Bay. Brittany Schmidt, WBAY.
Good afternoon. I want to go back to the testing in schools. So how long will the test results take to get back? So if kids get symptoms at school, will they test them right away? But will they need parental permission to do it? Or will it be, a standard waiting a number of days? And then if one child has symptoms or close contact, can the entire family be tested too? Or is it going to be different if they're in the same school or district?
Those are great questions. And let me share a little bit about what our recommendations are around that. And again, as we said, each school district will be customizing this. So in terms of consent, what we're really encouraging school districts to do is as part of their general back to school paperwork that they include a consent form for testing if their child exhibits symptoms. So kind of sign a blanket consent at the beginning of the year, and then when children present with symptoms, that will be on file and the district can go ahead and test a child right away. In terms of turnaround times, we're working very hard with our vendors and our transportation resources to be sure that all testing is turned around within 24 hours, because clearly the results of this testing is really important for knowing if the child has COVID or something else that might be treated in a different way, and also for knowing about exposures to others in both, as you mentioned, the home setting and in the school setting. So we'll be using a combination of the antigen tests, which are generally, we call them point of care tests. They develop very quickly and you have a result. There are situations where we want to confirm that result with what we call a PCR test, which has to go to the laboratory. And so there will be times that point of care test is sufficient and you'll have an answer in 15 minutes. But there will be other times and other situations where we'll want to use the PCR testing, and that will take a little bit longer. Again, our goal is within 24 hours. And then finally, your question about testing family members. We are making that available as part of the program. We will provide the supplies so that family members who are also symptomatic can come in and get tested. As we've often said, COVID doesn't know the boundary of the school wall or the boundary of a county line or a state line. And so if a child is ill and their whole family is ill, it makes a lot of sense to have everybody tested. And part of what we're really striving with this program is to make testing easily accessible across our state for people who are experiencing symptoms. So I hope I hit everything you focused on. And we're, again, really excited about this opportunity to expand testing in our state to protect our kids and their families as we enter the fall months.
Thank you for that answer. Let's go now to Taylor Lumpkin, TMJ4 in Milwaukee. Taylor, TMJ4. And a reminder, *6 will mute and unmute your phone, TMJ4. All right, we'll move on to Katrina Nickel, Fox 11 in Green Bay. Katrina Nickel.
Hi there. So my question is still on the testing that you're planning to be using with schools. I guess one question is, why might this still be necessary in late August, early September, if the goal is to have people continue to be getting vaccinated, especially that 12 to 18 age group?
So, why do you find it necessary? And also, how is the state paying for this program?
The easy answer is to the second. This is part of the American Rescue Plan Act. It is funding that is coming through the U.S. Department of Health and Human Services and CDC to pay for this. And so we received a $175 million grant to support this testing in schools throughout the next year. I'm going to turn to Dr. Westergaard because he's got a really good answer as to why this is important, and it goes to what he was saying before about respiratory viruses. So, Dr. Westergaard?
Yeah, I think the first reason it's really necessary or important is that by the time school goes around, we're not likely to have a majority of K through 12 students vaccinated. In fact, probably the majority will be unvaccinated. We don't know yet when children younger than 12 are going to be eligible to receive the vaccine. So very, very large numbers of students across the state are going to be vulnerable to COVID-19. The second reason is that we've seen already with COVID-19, and we've seen for generations now, that most, if not all, respiratory viruses follow a seasonal variation, a seasonal pattern. So right as kids start coming back to school, when the weather starts to get cold, all respiratory viruses tend to surge. And those two things are related. People spend more time indoors, there's more transmission going on. So it's going to be very important. It's likely that we're going to have more COVID-19 disease in the fall. And the third thing, which we mentioned before about other respiratory viruses, is a really important point, I think, because it's going to be, the fall 2021 respiratory virus season is going to be very different than the fall 2020 respiratory virus season, because in addition to whatever level of COVID-19 we have circulating, there's likely to be a lot of other virus circulating that we really haven't seen in the past year. The measures that we've taken with staying home and physical distancing and wearing masks were sufficient to really stamp out the spread of a lot of colds and flu viruses. And like I mentioned before, the data we're seeing is that those other respiratory viruses are already starting to march back. And we don't know what it's going to be like for our communities or our population, essentially to have had a year off of being exposed and developing immunity to rhinovirus and influenza virus and adenovirus and all of these other pathogens that tend to spread in the fall when school gets back in session. So if we have essentially a swarm of respiratory viruses, and there's a risk of COVID-19 coming back and surging in the fall, it's going to be critically important that anytime someone develops symptoms of a cold or flu, that we test them. Because if we don't do that, we're going to lose the signal of where is and when is COVID-19 spreading. And there's likely still going to be a significant number of adults and vulnerable adults who are unvaccinated. And if we let outbreaks or clusters of COVID-19 get too big, it's going to be putting other people at risk, both young and old. And our goal, as it's been all along, but I think especially now in the second year of the epidemic, is that we can prevent more deaths from this disease. And unfortunately, the way that we have to prevent deaths is preventing the spread among everybody. Those are the people who have relatively low risk of severe disease and people who have significant risk of severe disease, like the elderly and the immunocompromised. So that's really going to continue to be our goal, is to flatten the curve. And in this new, more complex epidemic phase that we're going to be entering this fall, where we have COVID-19 and a bunch of other viruses, testing is going to be essential. It's going to be very, very important in schools, in primary care clinics, and other places as well. So now is the time we need to be preparing those systems. How are we going to test people? How are we going to determine whether someone has a non-COVID virus or a COVID-19 virus? And this is a great example and a good use of resources to try to get testing in places where patients can get them without a lot of barriers.
Thank you. Let's go now to Heather Poltrock, WSAW in Wausau. Heather.
Hi, thank you for taking my call. I just wanted to talk about variants real quick, and I'm wondering if it's possible to neutralize or eliminate a variant, and then wondering also if we're making any progress on the variants.
Yes, I'd say the simple question is we can prevent the spread of variants with our existing vaccines. And that's been really good news. A feared development has been that, if because of genetic evolution, changes of the virus, that we might see the development of a variant that our vaccines don't cover. And it's very important that, we talk about the risk posed by new variants. The good news in this story is that our existing vaccines, all the ones that are authorized for use in the United States, are very effective at preventing disease caused by the new variants. So although they're new and they're important in that they're more highly contagious, our strategies remain the same. And that's been the very good news so far, is that we can say, go get vaccinated, and you're protected not only from the original strain of COVID-19 virus, but the new variants as well. So that's really our single best strategy of preventing variants, is just preventing the spread of COVID-19. We don't have specific tools right now, but we also don't need them. Right now, the tools we have are effective against the circulating variants.
Thank you for that. We go now to Julian Emerson at Up North News. Julian Emerson. *6 will mute and unmute your phone. Julian Emerson, Up North News. All right, moving on to WMTV in Madison. WMTV. WMTV in Madison. All right, well, we have time to reach back out to reporters who were not available at the top of the hour. Denise Lockwood, Racine County I. Denise Lockwood, Racine County I. Taylor Lumpkin, TMJ4, Milwaukee. Taylor Lumpkin, TMJ4. One more call for Up North News. Up North News, Wisconsin. And WMTV in Madison. All right, well, with that, we will wrap up today's briefing. We want to thank Deputy Secretary Julie Willems Van Dijk, Dr. Ryan Westergaard, and to all of you for participating in our last regularly scheduled briefing. We will stand these up again as needed, but in the meantime, we ask you to continue to monitor the DHS COVID-19 web pages for data and guidance. Additional information can be found on the websites of the Governor, the Department of Workforce Development, the Department of Public Instruction, the Department of Children and Families, and Wisconsin Emergency Management. Be safe and have a great afternoon.
This program is a production of Wisconsin Eye, an independent, nonpartisan, nonprofit media network with a mission to inform, educate, and engage the citizens of Wisconsin. Wisconsin Eye is the nation's first and only independently funded state civics broadcast network, providing gavel-to-gavel access to government proceedings and events at the state capitol.